How do I see those questions? Right, it's okay. I'm a professional, and I'm going to work with it because. Oh, here's the question thing. Oh, there you go. I've got it. Look at that. I've got 4, 5. My God, I've got 5. I've got 5 questions on Instagram already. Look at that. There's me worried I didn't have any questions. Anyway, I'm just going to assume I'm not going to do the old is the sound working and everything. I'm not going to do that. But is it? Is the sound working? Hello? Is the sound working? Okay, we'll just assume it is, shall we? I'm waving frantically at anyone who's waving at me. Right. Look at this. Where are we at? What we're doing. You know what I'm going to do? I'm going to do these questions because I can see me. Right. Okay. This is no, here we go. Yes. Thank you, Tracy. Sound is working. That is what we need. A little bit of interaction. That's what we need. And I know what you're thinking, Tracy. You're thinking, where's the thing that says what's going on? Well, there it is. Okay. Just as you thought it appeared. Live Q&A with this guy right here. Okay. So, Catherine says you. Yes, I can hear. Blimey, not many people. A lot of people are responding to the question. No one usually responds. I just stand here. Hope to God it is working. Okay, so I've got to be honest. I'm surprised. I've got some questions on Instagram. I'm constantly surprised by Instagram. Right, how to avoid? What can I press on it? Oh my God, has that question just come up on Instagram? It's come up on my screen. How to avoid the risk of stretch marks with breast enlargement. That is assuming the size of breast implants chosen is sensible. Right. God, cancel. What have I done there? So, how to avoid the risk? I think that's risk. Yes, risk of stretch marks. A lot of people worry about stretch marks with breast implants, and I've got to be honest, it's not a big problem for me. I can safely say I can think of 2 patients who have had stretch marks, and it's not even been that bad with them. They have settled. So it's not like it's happening very often. And I think that is because I don't use huge implants. I think if you use very big implants, you would run that risk. I tend not to go for those big ones that you see on on when you're checking your Yahoo emails and they get those photos at the side. No, is it just me? Okay, maybe I just get those photos. But you know what I'm saying, the big ones, really big ones. I don't go for really big ones. It's not really my bag. So I guess the answer is don't stretch the skin too much. So so the question was, how do you avoid the risk of stretch marks, assuming you go sensible? I think if you go sensible with the implants, it's less likely. Now, having said that, I do go sensible with the implants, and I have had 2 cases, so it's not zero. As with a lot of these things, the risk is not zero, but it's not a huge risk, and I would probably be more worried about other things because there are other risks. So I would be worried about other things before I would be worried about stretch marks, but it's in the mix. It's in the mix, and it's something to be aware of, that they can happen. But I think if you go sensible, it's less of a thing and less of an issue. So it's not high on the list of things. There are other things on the list that I would be more worried about than stretch marks. But I do think a lot of people worry about it more over and above how common it is. How do you get an appointment to see me? Oh, that's nice. Well, GB Murphy, you can phone or you can email or you can book it online. GB Murphy, staianoplasticsurgery.co.uk is the website, and you can book it online. And there's a question about why there's so many options when you book it online, but you can book an online appointment. We're doing virtual stuff like this, where are you and me, South Africa? I'm in Birmingham. Oh, that's Lynn. That's someone else. Oh, so I'm in Birmingham for a start off, in UK, United Kingdom. Lynn Emerson too, nose broken. Yeah, I also don't do noses, Lynn Emerson too. So I don't do noses, and I'm not in South Africa. So I'm probably not your first choice of surgeon. Probably surgeons who do broken noses and surgeons in South Africa would be above me. Plastic surgeons like myself do noses, but I don't. I do breast and body. So you would be looking for a plastic surgeon. Oh, UK. Where are you and me, South Africa? Yeah, look for a plastic surgeon, Lynn, and look for someone who does a lot of noses. I don't do any noses. So they're quite a niche in themselves, noses, to be honest. Right, Amy wants advice on best treatment for keloid scars. Already tried injections. Amy, you are in the right place, because that is my first question on my preordained questions. So Amy, stay tuned, because we're going to be talking about that after the break. But we definitely will be talking about keloid scars. And not only that, Amy, I've got some photos. And Khan is here. Long time no see, Khan. Nice to see you. Olivia is here. And Olivia's in Turkey Lurkey. Look at that. Turkey Lurkey. And Olivia can't hear. Oh, great, Olivia. Some people can hear. Olivia, is your sound turned on? I don't want to be. I don't want to. Oh, can now. Okay, there you go. Right. Well, good. Awesome. Thank goodness for that. So I just don't want to lose track of these questions here, because I've got some more questions here. Oh, they go. Oh, this is really good. When will you start operating at Solihull and Birmingham? I don't know, Natty Runs. I honestly don't know. It's a real problem. It's a real problem. And as you probably know, unless you've been hiding, things are looking not great in terms of the hospital's capacity. So the whole issue, the reason I'm not operating in Solihull and Birmingham is because the NHS is being overrun with all the COVID. So they're doing elective or planned work in the private hospitals in Solihull and Birmingham. And so they're not allowing people like me to do sort of elective or planned private work, which is fair enough. Can't argue with that. So when will I start? I don't know. As you might be aware, I've said in the past that it's going to be January, because that's what they've said to us. It's going to be January. I'm not so sure now, to be quite honest with you. What they said was the NHS contract ends in January, but of course they could renew it, couldn't they? I don't know if they've got. I don't know what where it stands in terms of renewing. So they told us we'd be back to normal in January, but do you think so? I don't think so. I am operating and I am doing GA. We have got GA facilities and local installation, but not in the private hospitals that I normally work at. So there are other places where people I know who've got facilities. But when I don't know what to say, Natty, they're telling me January, but I don't believe it. Easter, I don't know. Sooner than that, I don't know. Who knows? Losing sight of the UK. Oh God! Oh God! How do you go? Oh, done that one. Sorry, is my arm across? Come and Benoni and Rinfield. Come. COVID damn. Vaccine yippee. Midwife, sister, nurse, hard work, blonde hair. Lynn Emerson too. I don't know if you're in the right place. I'm going to be honest with you. I don't know if you're in the right place. This is mainly plastic surgery related to Q&A. Not quite sure whether that's relevant for you, but if it is, please stay here. If not, then good luck with that. But yeah. Oh, what's going on here? I've recently seen your magical work. My magical work. How neat are your tummy tuck scars and belly buttons? My husband was even really impressed, and that's a hard thing to do. Facebook, if you didn't hear that, that's on Instagram. Kim and family have recently seen my magical work and how neat my scars and belly buttons are. So that's the sort of endorsement we need, Kim. Thank you for that, Kim. Very kind. Michelle, also interested in keloid scars, and my arm's quite bad since having an arm lift. Where are you operating then? Lol, did you see my mad morphine deal? Email JJ, sorry. Don't worry. So we are getting, so thank you, Kim. That's very kind to get a bit of positivity there. Thank you. That's nice. What should I do? Should I do my keloid questions? Oh, I've got more questions here. I'm going to do my keloid questions because we're getting keloids. We've got keloid people in the Facebook. So let's do keloid. So this is the question here. So This is specifically from a patient who has got these keloids and they've asked, oh, I had the letter up. Here we go. Here's the letter. Tag removed from the breast, not sutured, and gallbladder removed. That's right. That's right. A few years ago. That's right. Okay. So we've got some scars here. Oh, I don't know how I can do this. Sorry, Instagram. I feel bad. I'm showing it on Facebook. You know what? I could show it. I have shown photos on Instagram, but I'm not. I'm prepared on Facebook, but I'm not on Instagram. So Facebook, what do you think? Whoops. Oopsie. Whoop. Loop. Loop. Anyway, what's the best one, do you think? I think that one. That one. Oh, I'm off to the side. So, Facebook people, Instagram people. Tonight, is that going to mean anyway? Instagram people, there's keloid scars on Facebook. Anyway, so basically, there's two scars. Can you probably can't see my so the middle photo? You probably can't see my arrow. The middle photo shows a scar from a keloid from a gallbladder removal. So that's a small scar, and that's gone quite red and lumpy. That's more of a traditional hypertrophic scar, I would say. The one on the breast is quite thickened, quite raised, and it says it was from a skin tag or something that wasn't sutured. So that's a bit of a that's the worry with keloid scars. The worry with keloid scars is that the scar will get bigger than the original injury. That's one of the issues with keloid scars. You end up with a scar that's bigger than the original scar. And that's one of the big differences between a keloid scar and a hypertrophic scar. So a hypertrophic scar, the scar is just where the initial injury was, and it's red and lumpy. A keloid extends out with the margins of the original scar, the original injury. And that one on the breast looks like, if it was quite a small thing and it's gone big, that is a worry. And this patient has contacted me, and this patient has had silicone dressings and has been using silicone dressings, and they haven't helped. And I've said the next step is steroid injections, which is the sort of next step in the hierarchy. So the first step is massage, moisturizing, a bit of pressure. Is the first step. If that doesn't work, you can move on to silicone dressings, which can come as sheets or can come as a gel. On areas like this, the sheet might be helpful if you can, particularly on the breast, if you can keep it on with your bra. If you can't keep it on, if it's on the face or on your ear or somewhere where you can't keep a silicone sheet on, then the gel can be useful. If that doesn't work, the next step is silicone dressings. So it is steroid injections. So once you've used the silicone, the next step is steroid injections. The problem or the issue this patient has is that she wants me to cut it out because she doesn't want to come for a steroid injection. If the steroid injection isn't going to work, she wants to go straight to cutting out. And I completely understand that, and I get where she's coming from. And I do feel a bit bad because, well, it's not like I feel bad. I mean, we charge for, obviously, well, we charge for everything, basically. Don't charge for follow-ups, but we charge for because the first thing is this. I mean, I don't know if the NHS will treat this, but if you're having it done privately, certainly if you're having it done privately with me, it's £200 for a steroid injection, and you often have to repeat it. I usually do a course of 3, about six weeks or so apart, and then leave it for a few months. So I understand where you're coming from on this one, because I think she's saying, look, I don't want to pay £600 like on 3 steroid injections, and what if they don't work and I have to have it cut out anyway? Then that's a waste of money. Totally understand that. Where I'm coming from is you've got to do the best treatment for the situation. And the best treatment is, once you've used silicone dressings, the best next step is steroid injections. And I totally understand that it might not work, but that is the right thing to do. So, my advice is, I think you should do steroid injections next, is my advice, because it might work. And if it works, then that's fine. Because the problem is, if we go to the step after that, which is excision, the risk of doing excision is that it can come back worse. And you often can combine an excision with steroid injections. We do what's called an intralesional excision, where we leave a little rim of the keloid behind once we've done the excision. So we're only cutting and stitching within the keloid scar, and then we use steroid injections for that little rim. But I would feel uncomfortable going straight to excision without trying steroid injections, because if the steroid injections work, you might not need excision, because excision has got a higher risk. Every time you go up the hierarchy, you're increasing the risk. The risk with silicone dressings and massage and pressure are less. Once you move up to steroid injection, there are risks with that. You can inject it too deep, in which case you can get fat necrosis, kill the fat, and the scar sits in a dent. You can inject it too superficially, in which case you kill the skin and get a little ulcer. So there are risks with doing steroid injections, although they're not that bad. And then if you move up to intralesional excision, then the risks are greater, because it can come back bigger than the original scar. So if you like, for instance, one of the breast, which is quite a big one, by the way, the one of the breast is if that's from a little injury and has more formed a big scar, if I then cut it out and give a big scar, then that big scar could form an even bigger keloid. So intralesional excision is risque. So I wouldn't feel comfortable moving to intralesional excision without trying steroids. Oh, sorry about that. Did I yawn live on TV then? I would do steroid injection next. And I know it just feels uncomfortable. And this is a problem with doing private medicine. If it was in the NHS, there'd be no question. But when you're paying for it, I understand how you might say, I don't want to waste my money on steroids if it's not going to work. You can't guarantee it's going to work. Well, no, I can't guarantee it's going to work. And you might waste your money on it, but you might not. It might work. From a medical point of view, the right thing to do now is steroid injections. If that doesn't work, then to do intralesional excision. And I know if it doesn't work, you're going to turn around and say, oh, you're a money grabber, you've done steroid injections just because you wanted the money. I'm not. I didn't just want the money. I just thought it was the right thing to do, because it could have worked, and we've got to be positive and hope it does work, because if it does work, then happy days, we don't need an excision. I would like to do that. I would like to do steroid injections, and then hopefully we won't need an excision. That's where I am on it. Kim and family says, why do keloids happen? We don't know, Kim and family. There's no animal model for it. We don't really know. There's a huge amount of research on it, but we don't really know is the easy answer. What's going on? Sorry, I missed stuff. How much breast? Question mark. Laughing. Will getting a rhinoplasty at a teenage have more changes than usual due to aging? Don't think so, no. But you do want to wait until you finish growing before having any sort of surgery. But I don't think it will have more changes than usual due to aging. Changes to the nose. No, I don't think so. But you've got to be careful having surgery as a teenage anyway. And I think most people wouldn't want to wait till you're a bit older. Olivia, is that a yes? Hold on a minute. What's going on here? Let's get rid of those photos. So I hope that's been helpful about the keloid scar. Is that a yes? Is what a yes? Simone Lake, hi, I'm really wanting to have breast reduction surgery. What's the ideal BMI to have this done? Good question, Simone. Thank you for asking that question. And the answer to that question is twofold, Simone. Number one fold is an absolute value for BMI, and that is 30. When they've done studies, they've said if your BMI is less than 30, you're going to have a lower risk of complications than if your BMI is above 30. So as a sort of general ballpark, we say if your BMI is less than 30, you can have a better result than if it's above 30. If it's above 30, you might have more risk of complications. But the second part, which I think is, equally, if not more important, is you want to be comfortable and stable with your weight. So I don't think anything magic happens at 30. But I do think that the lower your BMI, the less risk of complications and the better result you're going to get. So basically get your BMI as low as you can, or as low as you want to, and to be stable with your weight. Because what you don't want to do is to have weight fluctuations after surgery, Simone. You don't want to get your weight, to a certain level and then put on weight afterwards. Or you don't want to say, oh, and I understand this. People say my breasts are so big, it's very hard to exercise and I can't get my weight down. Once I've had my breast reduction, then I'll be able to lose weight. If you do that, you're going to have, first of all, you can have more risk of complications because you're having surgery at a higher weight. But secondly, part of a breast reduction is a lift. You're tightening the skin as well as reducing the volume. And if you tighten that skin and make it as tight as you can and give that lift part of the surgery, and then you go on to lose weight afterwards, you might have a bit of a droop. Your skin might, you might lose volume but not skin, and that might cause a bit of a droop, which isn't great. And if you'd lost the weight first, I could have made it tighter. So you're better off losing your weight first, getting your weight right and where you're comfortable. Ideally, a BMI less than 30. It's not written in stone. I have operated on people with a BMI above 30, And similarly, even if your BMI is below 30, if you're not comfortable with your weight and you want to get lower, get it lower first. Don't think, oh, good news, my BMI is 29, I can have my surgery now. If your goal weight is BMI 25, which is what we should all be aiming for, though I know that it's, it's pretty tough to get that, but that's what the sort of normal weight is. If that's your goal weight, then you should try and get it there before having surgery. Because if you have it at 29, have a breast reduction, and then lose weight, you might have a droop. And also you might lose volume and your breast might be too small then. It's hard to predict what's going to happen to the size of your breasts, because it's unpredictable what happens to the size of your breast with weight loss. So you ideally want to avoid fluctuations after surgery. So hope that's answered that question. What is going on here? Why did you breast lift star? Nice comment there, DMathXX. Thank you for that comment. Simone, Amy, Joanna Williams. I'm speaking for my husband. He's already tried steroid injections and it hasn't worked. They're still growing. Makes him so sad. Really need help, but struggling to find anyone. All right. Okay. Well, Amy, if you've tried steroid injections, then yes, the next step might be intralesional excision. It would certainly be worth a discussion about that, Amy. But yeah, if you've tried steroids and they haven't worked, then yes, steroid injection would be the next. But I've got to be honest with you, Amy, there's a risk it can come back worse. That's why we are a bit anxious about doing steroid injections. You'll find surgeons, we're a bit, because God knows we don't want it to come back worse. So as I say, usually you do what's called an intralesional steroid injection, where you debulk the keloid, leave a little rim of keloid behind, and then do steroid injections into that residual little bit to avoid cutting into normal skin. We don't want to cut into normal skin. We only cut keloid skin. So did you read the email? It's plagued me with worry all week. I don't think so, Olivia. No, I don't recall an email that I would be worried about. Don't worry, Olivia. Don't worry. Seeley, good evening, dude. I wear 3 sports bars to exercise. It's the only way. There you go. You heard it here first. Seeley wears 3 sports bars to exercise. I mean, what, on top of each other, Seeley? Is that necessary? 3? Okay, well, there you go. Simone, that's fab. We'll be seeing you next year. Okay, Simone. Don't rush. Don't want to rush. I look forward to seeing you next year, Simone. God knows we'll be in spacesuits then, probably. What about laser? Laser for keloid. Laser is good for red things. So laser may help if the keloid is red, Amy. But laser's not good for keloids in general. So laser's good. Laser's good for red scars. If you've got a red scar, then laser might help. But specifically for a keloid, I mean, there's different types of laser. So some lasers will target the red pigment. So if you have a red scar, there are lasers that are ablative lasers, like a CO2 laser. And a CO2 laser is a bit like a knife, really. So you can cut a keloid out with a CO2 laser. So you could sort of treat a keloid in that way with a laser. So yes, laser could be a thing that you could use for a keloid, but yeah, that would still be like an intralesional excision type thing. So yes, that might be an option. But I don't do laser, Amy, so I'm not the laser guy. That ain't me. Celia, I'm 34 double G. Yes, it is. So there you go. If you're 34 double G, 3 sports bras is the only way to go. I do heat every day 2 times, 15-minute sets with 5 minutes rest in between, but lose weight before boobs. There you go. That's the sort of third-party endorsement we need. Celia agrees with me. Lose weight before boobs, and the 15-minute sets with a 5-minute rest is one way to do it. So there you go. Who'd have thought it? Right, now Instagram. I have not, lest we forget the questions. Here we go. Tori has got, hi, do you still believe that implants are safe? All I read is so negative. Yeah, I get you. I feel you, sister. I feel you. There's a lot of negativity about implants, isn't there? Do you still believe breast implants are safe? Well, what do we say to that question? It's an emotive subject, Tori, and people get very emotive about it and will say, oh, you're doing terrible things, your using implants aren't safe and they cause terrible things and it's all awful because this person had an implant and they had a terrible thing happen. I mean, there are risks with having implants, you know, fact. Yeah, I mean, there's risks with everything. I mean, we've just been talking about keloids, the most common form of cosmetic surgery in the world, if you like, is pierced ears. And pierced ears can get keloids and they look awful and they're terrible, very, very rare in terms of numbers of people who have pierced ears versus numbers of people who have keloid scars, very low. But it's a risk. There's risks with any surgery and there are risks with breast implants. So, I don't know what to say when you say, do you believe that breast implants are still safe? Yes, I do. I don't think they're dangerous. I think breast implants are safe. Having said that, you can get complications if you have breast implants. I'm not saying that you won't have a complication. I'm not saying you won't come to harm. You might come to harm. You might have a complication if you have a breast implant. In the same way that you might have a complication if you have any surgery whatsoever. I think I can safely say any surgery whatsoever, you could come to harm. Now, that doesn't mean that surgery isn't safe. That doesn't mean that, I don't know what you want to think about, cataracts or hip replacements or any surgery, any surgery you can think of, gallbladder removals, any surgery that any surgeon does runs the risk of complications and you might have an unfavorable result. And breast implants is certainly no different. Having said that, the risk of complications with breast implants is extremely low. But you're absolutely right. All you ever read about is the negativity. You read an awful lot of negativity about breast implants. And so what I would say to you and what I would say to anyone thinking of having breast implants is you've got to weigh it up. You've got to weigh up the pros and the cons. And if the cons outweigh the pros, then for goodness sake, don't have it done. Absolutely no problem. Don't have it done. If you don't want a complication, if you don't want a risk, don't have breast implants. There's an absolutely very clear free choice out there. You don't have to have an implant if you are worried about the complications. Well, not if you're worried about it. I think everyone's worried about it. But if you feel that risk outweighs the benefits you're going to get from it, and that's the thing, that's the nubbins. People do get benefit from breast implants, and I think that is what people lose sight of when they go on about how bad implants are and how terrible they are and how naughty I am as being a person putting implants in people, which could make them come to harm, and how I should be doing something more needy and doing something more, spending my time doing open heart surgery rather than doing this stupid surgery which shouldn't be done. And I think the reason that the thing that people are missing is that actually breast implants do improve people's quality of life. And I think, from anecdotally and scientifically, they've been shown to make people happier and feel better about themselves. Now, you could argue, and people do argue, that you shouldn't feel bad about your body and we should be happy as we are. And it's terrible that these people are propagating this and what have you. That's a bigger thing, and I would love us not to be worried about our bodies and, not be feel that we have to do things to change our bodies. But, it's what it is. We wear I say we wear makeup. People wear makeup. Hope it's not too thick, my makeup at the moment. But people wear makeup and they wear clothes, and they cut their hair. And they have cool haircuts like this. They look cool. Jason Statham haircut. People feel good when they feel that they are looking slick like myself. People, and they do. All right, they do. So that is the nubbins. So if you don't think you're going to get that much benefit from it, and you think, hold on a minute, I don't want all these bad things to happen to me, well, don't have it done, because then they can guarantee those bad things won't happen to you. But you won't get the benefits from having breast implants. So yeah, perhaps I spoke a bit too long on that, but it is something that's close to my heart, because I think it is very easy for people to get a headline to say, look, breast implants cause cancer, breast implants kill people, breast implants, cause all these terrible things, and yeah, they do. You know, and the reporter spoke to me a while ago. It was this year, saying, "Isn't it?" Or maybe it wasn't this year. Was it this year? Anyway, she said, "Isn't it terrible? We are putting these implants in our women, and they're dying. Women are dying. It's terrible from this ALCL, which is a type of cancer associated with implants. And on the face of it, you think, crikey, that's awful. Putting breast implants in and people are dying. That shouldn't be. That can't be allowed. Surely, you can understand how people get outraged about that, and that you could think that's terrible. But then actually, you look at the statistics, and you look at the figures, and you look at the risks, and you look at how common people are dying having breast implants in, and actually, it's not very common. And people are dying driving in cars. People are dying crossing the street. People are dying doing a lot of things that we take for granted every day. And there's a risk with everything. And, there's a paper which looked at the risk of skiing, for instance, saying if you go skiing for a week, I think it was, your risk of dying is twice your risk of dying if you have breast implants in for life. So, you could say, look at this terrible thing we're doing. We're putting these big, long, flat things on our feet and going hurtling down snow-covered mountains, and people are dying. Our women are dying, our men are dying even from that. It's a terrible thing. We must outlaw it, and we must ban it instantly, because it's a stupid thing to do, to go down a icy slope with a long, piece of wood or whatever they're made out of on your foot. They're probably not made out of wood these days, are they? What, they fiberglass? Anyway, so should we outlaw skiing because people are dying skiing and coming to great harm skiing? And certainly the risk of skiing is certainly a lot worse than the risk of having implants. So do you believe skiing is safe? Depends on the benefit. Yeah, anyway. Right, I'll move off that. There you go. So yes, I do still use implants despite the negative press. I do use implants, but if I can talk someone out of having implants, I will. If someone's borderline, if they're breast lift with implants, borderline type, I'll be like, why don't you just have a lift and leave the implants off? Because implants can cause problems. No doubt about it. Never mind the terrible problems. They can cause rippling. You can feel the edges. You can get infection. There are sort of much more normal things, or much more common things that can be an issue. There's no question about it. They can cause issues, and so you have to go in with your eyes open. That's what I would say. Sorry, Tori, that was a long one. Have I missed the implant update? No, you haven't, Tori. That was it there, right there, girlfriend. Right, what have I missed here? God. Oh, God, this is it. There's only a few people in the country who can handle Instagram and Facebook at the same time, and I'm not one of them. But anyway, let's see how we get on. High-intensity training. Okay. High-intensity training. Right. What does your HB level need to be before surgery? Wow, Stacey, you're getting technical on me. Interesting question, that, Stacey. To be honest with you, Stacey, well, firstly, it depends what surgery you're having, because a lot of surgery, to be honest with you, Stacey, I wouldn't do a full blood count for something like a breast augmentation. I wouldn't do a full blood count. I wouldn't check your HB level. Now, some places routinely do blood tests for these sorts of surgeries, but I don't want one. And if you are functioning, if you are walking around and fit and healthy, that's fine. You are obviously capable of functioning, sort of thing. And so I don't want to know what your HB level is. However, if you've got a problem, and I'm guessing might have a problem with the fact you're asking a question. So if you are anemic, and if you do suffer from anemia, then we've got to look at what is the cause of your anemia. Is there something we can do to optimize your situation to get your hemoglobin optimized? Because what you're looking for, and I've seen people, and usually it's for people who are chronically ill, I've seen people with very low hemoglobin levels who are coping very well. Hemoglobin level is 7, or I think now they measure it as 70. But anyway, that's pretty low. It should be 13, 15 sort of thing. So hemoglobin is a really low level, but they're absolutely fine because they've had chronic low hemoglobin, and they're coping very well. Whereas you or I, if we went to a hemoglobin of 7, we'd be unconscious because we probably had lost a lot of blood acutely, suddenly. So the absolute level is not quite so important, but you probably want it over 10, I'm guessing. It will be up to the anaesthetist as well. For bigger operations like tummy tucks, breast reductions, where there might be a little bit of blood loss, dare I say, you'd probably be a bit more worried about it, a bit more wary about it. But that's why it's important to do a baseline hemoglobin, not only to see what your hemoglobin is, but to so we know post-op how much it's dropped. Because if you're running a hemoglobin 11 normally, and it's and it's 11 afterwards or 10 afterwards, then that's less of a worry. Whereas if you're 15 before and you went to 10, we'd be a bit more worried. But yeah, so I haven't got a specific number, Stacey. But if you are anemic, we probably have to look into it and make sure you're optimized. And the main thing is, are you symptomatic? If you're symptomatic, I'd be more worried. If you get tired, lethargic all the time, breathless, then I'd be thinking, hold on a minute, is surgery right? You're not optimized. You're not in a good position for surgery. What's going on? What's going on? Olivia, question. Ask JJ, could one Olivia like it? What is the best and safest position to lie and sleep in after breast lift, stroke, implants, and tummy tuck? It's a right pain. Most of this stuff, Olivia, your body will tell you. The breast, not quite so much of a problem. Usually, you suggest people wear a supportive bra for your breast. Some people say sit up because of swelling. I don't personally. I don't tell people to sit up because I think sleeping is important, and a lot of people can't sleep sitting up. The tummy tuck is probably the main one. Now, when you're in the hospital, we sort of tend to break your bed, which is sit you up and put pillows under your knees, which you probably can't do when you're at home. But what you would probably naturally do is get into the fetal position. So lie on your side in the fetal position with your legs bent up, just to take tension off your tummy. So that's probably what I would say is the best position. The best position is the most comfortable position because you need to get a good night's sleep, really, don't you? So yeah, probably crouched into a fetal position, lying on your side is where I would be with that. Is this another one? Question asked JJ. Yeah, okay. Question asked JJ. When will my boobs lower a bit? They look a bit like an alien on my body. Okay. So Olivia, need a bit of context there. Did you have? So I'm thinking you've had surgery recently. So I normally say to people, things really start to settle about 3 months. So they can be a bit full to start off with. So about 3 months is where you get an idea where you're going to be, but it can take 6, 12, even 18 months for it to properly settle. It can take a while. Olivia's on fire here. What are the reasons for fluid drains in tummy tuck? Because there's a space there, Olivia. There's quite a raw area and a raw space when we do the surgery, and that raw area can ooze, and that is what the drains do. They take away that ooze. Vivian A. Underwood. Brilliant advice. Now, Instagram, you can't see this, but take my word for it. Brilliant advice. Is the surgery so important that you would suffer a complication for it? Question mark. Well, there you go, Vivian. If not, don't do it. Don't do it. Yeah, absolutely. Yeah. So that's it. You've got to be aware of the complications. And if you think, hold on a minute, I don't want a hematoma, I don't want an infection, I don't want a wound breakdown, I don't want a scar. I mean, some people say, a scar's not even a complication. Scars are definite. Oh, I've got a question about that in my list about having to do something without a scar. If you don't want a scar, then that's fine. You don't have to have a scar or a hematoma or an infection or any of these complications. Don't have the surgery. It's a perfectly reasonable course of treatment, is sort of no treatment, if you like, in this sort of world. So yes, absolutely, Vivian. Amen, sister. Plastics isn't stupid. It totally affects your life, especially after weight loss with loose skin. Well, there you go. There's the other flip. Look at that. Two sides of the coin. Well, that's it, Olivia. And I think people don't realize that. I think people without any sort of problems, if you like, or without who don't need it. Like people say, well, would you ever have plastic surgery? I'm always like, well, it depends if I need it or not. If I need it, then I'd weigh up the pros and cons and make a decision. But if I don't need it, of course I wouldn't. Well, it's ridiculous. It's like saying, would you have brain surgery? Well, not if I don't need it. No. If I did need it, then maybe. If the benefits were outweighed by the risks. Same with anything. Stacey, I was refused abroad with 114 for tummy tuck last week. 114 is sort of low. I call that 11.4, but who can say? I don't know, Stacey. The main thing is, I would say, is that what is it? Do you know what it is normally, or was that just? I think if you're asymptomatic, the tummy tuck is a bigger operation, Stacey. The problem, the thing is, if they're going to refuse you, what are they going to suggest you do? Or do they suggest you go to your GP and get investigated, or what? But yeah, I really don't know what our anaesthetist would do with this hemoglobin 114, whether they'd refuse you or not. But it is a bit on the low side, so you might need investigation for that, Stacey, if you haven't already. Thank you. Well, thank you, Olivia. I had most of my pain from my boobies. I've been sleeping very badly. Well, you do need to sleep properly. I think that is a big thing. I had surgery on Friday. Boob lift, 200cc implants and TT. Nice. Well, Friday's early days. Would you advise against going abroad for surgery? I do, Stacey. Yes, I do advise against going abroad for surgery. Um, um, I understand why people do it, and I think it's quite clear that obviously it's a lot cheaper abroad for surgery. But I do think if you can go close to home, it is better. You are going to have a surgeon more easily available for help and advice, and it's a bit easier to tell in terms of the training and in terms of uh, um, the levels that the clinic is operating under. It's quite strict in the UK. You've got this thing called the CQC, the Care Quality Commission, which will ensure that everyone has process and protocols in place to, deal with infection control and to do with staff training and to do with complaint handling and all these things. We are regulated and governed by overseen by a body, which if you're not happy with anything, you can always go and say, hey, hold on a minute, I'm not happy with that. Whereas overseas, it's a bit more difficult to know whether these things are happening and whether you got any comeback if you have any, any complaints or any concerns about how you've been treated. And it's just a hassle. If you have a problem and you've got to go back abroad to have it fixed, it's a hassle. So yeah, there's a few reasons. And if you want to know more reasons, Stacey, you're more than welcome. Oh, how long's that bit of the phone been there? You're more than welcome to have a copy of my book, which is available from all good booksellers. I don't think it is actually. It's available from Amazon, but it's also available from neveracceptaliftfromstrangers.com, my website. And I say it's $12.99 on Amazon, free on my website, free if you want to come and pick it up. If you don't want to come and pick it up, we'll post it to your door for $3.95 postage, I think it is. Anyway, there you go. Kim, you'll be happy with that. Bit of a post for my book. But yeah. Olivia, today boob drains came out, but tummy drain has been left in till Saturday. Okay. Stacey, defo hun, not worth it. Oh, there you go. Your main problem abroad is the language barrier. It's very hard in hospital when the nurses don't speak English. Thank goodness for Google Translate. Yeah, well, that's another. Yeah, there you go. Right, what's Kim up to? Kim is up to, when surgeons use drains, how long are they used for? If only for a short time, do you run the risk of filling up with whatever it is the drains are used for? Should it be longer, the better? Good question, Kim. So yes, absolutely. What is the drain used for? So Kim, brilliant book. Thank you, Kim. So in my hands, because some people use drains for different lengths of time. So in my hands, I've got to be honest with you, Kim, we're moving away from drains, just as a general thing. I still do use it for bigger breast reductions and tummy tucks. And they're used they're suction drains. So they're negative pressure, sucking the skin flaps together. And they're mainly used for blood, for hematoma, so blood doesn't collect in that space. And so when you have a drain, I'm talking about tummy tuck really here, you'll see the first day or so, it's blood, it's red. And that's what they're used for, to get the blood out. After the first day, it turns this clear yellowy color, which is serous fluid, which is watery fluid. And that can come for a few days afterwards. That's wound fluid. And sometimes the presence of the drain can create irritation and create more seroma, more serous fluid to come. So I usually just use it for the blood. So I usually have it in for a day, maybe 2 days, but I don't have it in by and large longer than that. The shorter the better in my experience, because a drain has got a portal from the outside to the inside, so it is a potential portal for infection, particularly with breast implants, but don't really use them for breast implants anymore because we do worry about infection for that. But for any operation, it is a portal from the outside to the inside, so we don't really want to. So I don't, in my practice, no, the longer the better is not true. I don't like them. I don't like them being in for too long, and I don't like them at all. I don't like drains particularly, but I do think they serve a purpose. So I usually just have them in for a day or so after a tummy tuck would be my use of drains personally. But everyone's different, so I guess you've got to talk to your surgeon if they've got a different experience of that. Can you explain in more detail about the gap in tummy, please? The gap in tummy. Do you mean the divarification of the recti? Six-pack muscles, two six-pack muscles go straight down, tummy. And when you put on weight or have children, they can pull apart. Is that what you mean by the gap? That's what's called divarification of the recti or diastasis recti. And when you do a tummy tuck, you bring them back together again. And that can cause a bit of pain above the belly button. Is that what you mean by the gap, Olivia? Not sure what the gap. Oh, Flowers in Capri have joined. Pronto. Ciao, bella. Ciao. Come stai? Gastric Fantastic Seeley's joined. What's happened to Facebook? That needs draining. Oh, the gap that needs draining. No, it's not a gap. It's a space, because when you do a tummy tuck, you take all the tissue from the belly button down to your pubic area. All that goes. Now, if you just imagine that, you can't close the skin if you just cut that out. So you have to undermine all the way up to your rib cage. You have to undermine all the tissue up to your rib cage, and that creates a space, and that allows you to pull that skin flap down. So that's the space where you drain. That's what you drain. So that's the gap. It's not really a gap, it's a space. Vivia, who do you hugely admire? Olivia, are you a family member who's come on to put good things? Hugely admire your ability. I'm not making this up. Instagram. You can go on Facebook and see this yourself. This has been written by a real person. Hugely admire your ability to remain completely professional, impartial, and available for free. That's right, guys. I'm not charging you. You're not going to get a bill. Don't worry. For questions almost every Tuesday evening, questioning session, inspirational and down to earth. Thank you. Just end it there, I think. It says it all. Thanks, Vivian. About time I got a bit of recognition. Huh? That's what we're talking about. Just going to leave that on the screen for a bit. Take a screenshot, guys. Have a good read of that. Is there a thing called Baxter's glue where you don't need drains? I don't think it's called Baxter's glue. Baxter's glue sounds like something you get from the butcher. There is a thing called Tisseal, which is tissue glue, and I think it's made by Baxter. So I think that might be what you're talking about, but it's called Tisseal. Well, I'm sure other types of glue are available, so I don't want to make, but there is a fibrin glue. Should we just say it's fibrin glue? That's what it is. It's fibrin. Some would say fibrin. I say fibrin, but anyway. Yes, there is, Stacey. There is glue when you don't need drains, indeed. So some people put glue into that space and avoid the need for drains. I don't, but it is a way of doing it. It's definitely a way of doing it using the fibrin glue. That's a perfectly acceptable way, and it would avoid the use of drains. So, Olivia, funnily, I didn't have muscle repair. Well, that's good. That's good. It'd be less painful without muscle repair. Stacey, also, does having a tummy tuck give your thighs a slight uplift? Thank you so much for answering all these questions. No. Well, you're welcome. Second part of the question first. And no. Again, in my experience, no. The tummy tuck, the whole point of the tummy tuck, well, not the whole point of the tummy tuck, but one point of the tummy tuck, if you can get your head around this, Stacey, you're cutting out a big ellipse of skin. You're going from your pubic area to your to above your belly button, and you're taking all that skin out. When you stitch it up, if it was a normal piece of skin, if you cut out a normal ellipse of skin and stitch it up, the scar ends up halfway between the two, which would mean the scar would end up halfway in your abdomen and would look ridiculous. And we want the scar to be down. We want the scar to be in your pubic area. So we want your pubic area to be anchored, and therefore we undermine up north, like this is a gap that Olivia's talking about. We undermine up north all the way up to your rib cage, and then pull the upper skin flap down to meet the lower skin flap. We want the lower skin flap to stay where it is. We don't want to undermine south from the lower skin flap, because that will make the scar drift up. So that lower skin flap's anchored. So the upper skin flap is pulled down to contour the abdomen. So we don't want any pull coming from the thigh. So we won't be, so it doesn't affect your thigh, basically. It doesn't give your thigh a slight lift. I'm sorry. I know the way you said it, you're hoping it's going to give a bit of a thigh lift, but it doesn't really do anything to your thigh. So again, a lot of this surgery is about going in with realistic expectations. And I think if you're expecting something to happen to your thigh, I would be like, I don't think it will, Stacey. Sorry. Your thigh is because we want that to be anchored in the lower part. We want that lower part to be anchored and the upper part to be pulled down, so we don't have any pull south. There's no southward pull. It's all north down, no south up. Makes sense to me. I don't know if it makes sense to you. I think I need a whiteboard. Laura Leanne Malady. Yes, Malady. How long do you recommend sleeping on your back after a breast augmentation? I'm dying to sleep on my side. I'm 2 weeks post-op today and just wondering how advice differs between surgeons. Well, this is it, Malady, because unless you've changed your name, Malady, I don't believe you're my patient. So this is where I've got to be a bit careful, Malady, because I don't really want to be telling you stuff that then you go and act on, and then it all goes horribly wrong, and then you go and say, this guy on the internet told me to do this. So do what your surgeon says, Malady, because we have all got our own experience, and that is the problem with plastic surgery. I'm not sure if problem is the right word, but that is the thing about plastic surgery. You'll find a lot of us, they'd say it's an art more than a science, is a sort of nice way of putting it. But we all have our nuances. We all have our little ways of doing things. Some people leave drains in for ages. Some people don't use drains at all. Some people have drains in for a day. You know, some people say, for God's sake, don't lie on your side, or you've got to sleep upright, and you've got to do this, you've got to do that. Other people say, no, you've got to do that, and the other. So I would do what your surgeon says, milady. I don't want to tell you stuff that is against your surgeon. In my practice for breast augmentation, I believe a good night's sleep is more important than the swelling thing. So I give people a post-op bra to wear. They wear the bra day and night for a month, and I don't tell them anything about sleeping. I give them no advice about sleeping. I don't say you've got to sleep this way or that way or anything. I don't say anything about it. Sometimes people come to me after operation and say, when can I start sleeping, flat, or when can I start sleeping on my side? I'm like, well, when did I say you couldn't? And it's because the nurse has told them they've got to sleep with your head up and all that sort of stuff. I'm like, well, that wasn't, that's not me. I don't tell them anything. I say sleep whichever way you want to sleep. I think it's going to be uncomfortable to sleep on your front, obviously, because you just have breast augmentation. Your body won't let you sleep on your front. It'll be really uncomfortable. But I let people sleep on the side straight off the bat. I don't tell them to sleep up. People tell them to sit up because it helps with swelling. That's a fact. It does help with swelling. No question about it. Gravity is on your side if you're sleeping up. But if you can't sleep, I think that's bad. And I think it's more important to be able to sleep than to worry about the swelling. So but as you say, it's different between surgeons. So do what your surgeon says. Don't listen to me, Laura. Don't listen to me. Do what your surgeon says. Vivian Underwood, agree, he's amazing. Instagram, I'm not making this up. There's a wave of support coming from Facebook. I was stuck between him and CC Cat for my surgery. I ultimately went with CC Cat. Mainly due to her being female and being available sooner. Oh, right, it's getting okay. Sorry, JJ, but it was such a hard decision. I love him. His personality is amazing also, and he has spoken highly of at Cat & Co. Well, there you go. Well, okay. Well, Charlotte almost had surgery with me, but that's good. Thanks, Charlotte. Thanks for your vote of confidence. Any votes of confidence are gratefully received, and that's great, Charlotte. And I'm very pleased to hear that. Thank you, and I hope all's gone well. Olivia, is it normal for back pain during the hunched off period following tummy tuck, and is a week about right to be able to straighten up? Yes, and yes, it is normal for back pain because you're hunched over and my back hurts and it's really uncomfortable and it's a bit of a pain. And I'd say a week to 2 weeks, Olivia. Depends on how tight it was. Some people are okay at a week. Sometimes it takes longer. But yeah, it does hurt your back and it will get better over time. Laura says, thank you. Thank you, Laura, for asking the question. I may have a little try sleeping on my side tonight. Well, not if they haven't told you to, Olivia. Don't do it because I said, oh my God. I don't charge either. My private journey, you are my first choice. That's what we need. Right. Yeah, none of these others. The others went with someone else because what was it? Her being female and available sooner. What kind of reason is that, eh? Honestly. Just because he's female and available sooner. I've got a female side and I can try and be available, Anyway, hey ho. What can you do? Can't win them all. Can't win them all. Right. What's going on here? Stacey, this has been so helpful to me. What is the real difference between mini and full tummy tuck? Look at that. Questions coming thick and fast. That's a good one, Stacey. The main difference between a mini and a full tummy tuck is that a mini tummy tuck has a shorter scar than a full tummy tuck. A full tummy tuck goes from hip to hip. A mini is a bit longer than your cesarean scar. I'll say yours is, I don't even know if you've got a cesarean scar, but if you have got a cesarean scar, it's a bit longer than that. Whereas a full is hip to hip. Also, a full tummy tuck is a scar around the belly button. There is no scar around the belly button with a mini tummy tuck. So a mini tummy tuck is less scarring, but a mini tummy tuck really only addresses an excess of skin above your pubic area. So again, if you've got a cesarean scar, bulge above the cesarean scar, mini tummy tuck's good at that. Fixes that. That's good. Can pull your belly button down a little bit, so your belly button can look a bit stretched down, but it's really good for that. A full tummy tuck is a bigger operation, bigger scar. You go above the belly button with a full tummy tuck, which you don't with a mini tummy tuck. So you can repair those muscles if they are splayed apart, which you can't really do with a mini tummy tuck. And you get a more comprehensive contouring of the whole abdomen with a full tummy tuck, but it's more expensive. There's more traumatic, more risks, more scarring, you're more bent over, the recovery's longer. So it's a bigger operation with more skin removed, more of an effect, but more of a downtime and sort of risks of complications, etc. So it depends on how much contouring you need / want of your abdomen. If you want more contouring, then a full tummy tuck will give you more. If you just got a little bulge above your cesarean, then maybe a full tummy tuck would be the one to go for. Olivia, you should start doing butt lifts, not Brazilian. I still need that. Not interested, Olivia. Not interested. It's like faces, Botox, fillers. There's loads of things people say I should do, but I don't really. I'm not interested in doing butt lifts. I think post-op recovery is tricky, and again, it's a bit like noses. Go with someone who knows what they're doing. Knows, no pun intended. Sorry, JJ, that's might be a compliment. Believe me, I'm obsessive. I did so much research on both of you. I know it was, Charlotte. I know it was. It was just when I read it out live on TV. I thought it started off well, but it was a compliment, Charlotte. And I say to people, I say this to people in the clinic. I think it is absolutely fine to go and look at other surgeons, and sometimes one will resonate more with you, or be female, or be available soon, or whatever, and that is absolutely fine. We all know. And CC or with all the other surgeons in the area, we all know that some people will resonate with them and some people resonate with me, and it's absolutely fine, and it's fine, and it was taken as a compliment. So thank you very much. I did take it as a compliment. They didn't talk to me about sleeping positions. Well, there you go. Well, sleep whatever's comfortable then. Sleep however you're comfortable. That's where I'm going. Right. Have we still got any questions to do? God, this is now where are they? Oh, here we go. What consultation? Oh, yeah, here we go. What consultation would you recommend? As I can see, there are 4 options. So this person has tried to book an appointment online, and I believe I'm right in saying that it's going to say virtual consultation with me, virtual consultation with Kuram. Oh no, it won't say that. Won't be 2 because we're both the same, I think. And then there's full consultation with me, full consultation with Kuram. So there should only be 3. Is there 4? Anyway. Maybe anyway. So that's a good question. So basically what we're doing now, because of all the corona and all the distancing and what have you, and lockdowns, etc., we're doing the virtual consultations. So the virtual consultations is like this. So they're charged for, they're £35. If you don't want to pay, that's absolutely fine. Just come on Facebook Live on a Tuesday night and we'll do it for free. So that's absolutely fine. We can do it for free on Facebook Live. But they're like this, where we have a chat and I can share my screen with you if you want to see some photos or something. But it's just really a chat, really. And then the full consultation, which can also be virtual. That's confusing, isn't it? So the full consultation, if you're going to have surgery, certainly if you're going to have the bigger surgery, like a tummy tuck or a breast surgery or something like that, I'm going to have to examine you in the clinic for a full consultation, which will be done at the clinic. And we are doing consultations at the clinic, and I'll examine you and see what's what. If you're having implants, we can do sizes, etc. So that's a full consultation. So that's paid for. You can have a full virtual consultation where, again, it's paid for, and we do a full slide share, and we do a full talk in depth about what's involved, and that includes a free in-person consultation as well. Crikey, I haven't explained this question very well, have I? Can we do it again? So what was the question? What is a full recommend? Yeah. So basically you got a sort of a chat or a full consultation. The chat is always virtual. The full consultations is virtual, but can be in person. I'm really sorry I didn't explain that very well, but that's what it is. Can I just gloss over it? I'm just going to gloss over because Olivia's asked a question. You're amazing, JJ. It was only availability that made me go abroad and impatience. There you go. More people who I haven't operated on. That's what we want. Bit of positivity. Vivian, can you do Q&A on weight loss, age, skin, surgery soon? Different things to consider for different ages. Oh my God. Vivian, I do it every week. Can you be a bit more specific? Weight loss / age / skin / surgery. Different things to consider for different ages. I don't know, Vivian. All right. I'll give it to Megan to see if she can frame some questions around it. I like questions. Speaking of which, have I done all my questions on Instagram? No, I haven't. What's this? How can I use this voice? Very good. The voice. It was on you. I don't know. You have to do it on when you do an Instagram post. There was a little thing that was like all the masks, and one of them was a voice. Crikey, I'm not an expert, but it was that's how you do it. You do an Instagram post. No, story. You have to go into, not story. Is it stories or post? The one that doesn't last long, not the one in the feed. Is that called a story? Yeah, that's called a story. So you do an Instagram story, then you can do the voice, and then you can post it on the feed. Instagram tutorial 101. Yeah, so you have to do it as a story, then you've got the options to do the voices and stuff, and then you can post it on your feed. Okay, any more Instagram questions about how to do the ins and outs? That is all my questions on Instagram, which is absolutely fantastic for that. Hold on a minute. Skin then. All right, then skin then. Do it as Q&A, skin at different ages. Okay. Charlotte Chanel, the money you pay, the more in-depth the consultation will be. If you are set on him being your surgeon, just pay for the full one. You heard, Charlotte. Just pay for the full one, guys. Do research first, then decide on a few surgeons, then pay for the consultation whom you think you're more likely to go with. That's what I did. Yeah, she went with CC Cat, but still, whatever. But anyway, yes. Okay, guys, that's the message from Charlotte. So just pay for the full one. Yeah, well, you could do that, but yeah, okay. Thank you for that, Charlotte. Where's my questions? Here we go. Is scar management included in the aftercare? Yeah. So then, I mean, the aftercare is, as I said earlier, I feel a bit bad saying earlier we charge for everything. That made it sound bad. We don't charge for the aftercare. So in terms of following up patients, we don't charge. And to be honest with you, scar management usually, in my practice anyway, it revolves around massage, moisturizer, massage, nothing special. We do sell moisturizer, but any sort of moisturizer will do. You don't, just a moisturizer that you use on your body to massage your scars, and time. That is the best thing. Moisturize, massage, time, good diet, don't smoke, avoid sun exposure. These are all things that you can help your skin. Here we go. There we go. Vivian, things for your skin. Yeah. Keep well hydrated, balanced diet, avoid sun, don't smoke. So that is scar management in a nutshell. I mean, we do have products. If you have a problem scar, if you have like a red lumpy scar, hypertrophic / keloid scar, and you would have to pay for those products, but hardly anyone needs them. So scar management or scar care, we will talk to you about it. I will talk to you about it. Vicky, the nurse, will talk to you about it, and that is all part of it, part of the service. Stacey, if I was to send a photo, would you be able to tell by that if I need a mini or full? Sort of, Stacey, sort of. But I'd really need to have to talk to you about, I get, yeah. I guess I'd have be able to say, because some people can't have a full. If you haven't got a lot of skin there, you can't have a full. So I guess I could say, look, I think you can't have a full, so maybe a mini is all you can have. But if you could have a full, then I'd have to have a discussion with you about what you want to get out of it, and show you some photos of fulls and minis. You could have a bash, Stacey. You could have a bash. Send me a photo, and I'll have a go. But I can't be too specific to tell you, oh, you need a full or you need a mini. It really needs a discussion with the patient as to how much scarring they're willing to put up with versus how much a result they want, sort of thing. More money. Vivian, I always advise my friends to lose weight when excessive as young as they can, otherwise skin doesn't ping back. Absolutely, you're absolutely right, Vivian. That is the problem. The longer you are overweight and the older you are, the more your skin loses its elasticity, and the less likely it is to ping back, as you say. So absolutely, Vivian, good advice. Charlotte, love you. JJ, love you. Charlotte, love you too. Thanks for your positivity and your kind words, even though anyway. But yeah, thank you very much. Right, what's going on is I don't. Oh, here we go. I didn't want any visible scarring, so if there are other ways to have a lift and implant without the scarring lollipop effect. Well, what were we talking about earlier? Something about this? No, no, I don't know of any ways to have a lift and implant without the scarring. No. Now, well, yes, I suppose there are, having said no. I mean, you can do less scarring. So, in my hands, if you're having a lift and implants, the minimum scarring is the lollipop. It's the minimum. You can do it circumareola. You can just have a scar around the areola. I've got to be honest with you. I wouldn't say it's not visible scarring. You can see that scar around the areola because it's on the areola. It's on the front. When you just have implants, you have the scar under there, and that once it's settled, can be pretty hard to see. But once you get into the lift arena, you're lifting the nipple. That's the problem. So the scarring has to be around the nipple. So I've got to be honest, the scarring is visible. Now, the hope is it will fade, and it will fade well. And for me, the scarring of the lollipop is better than the circumareola. The circumareola, you're stitching a big circle into a small circle, and it's often cinched up and rucked up. Whereas when you do the lollipop, you're bringing that rucking up down into that vertical scar, and often you get a little bump at the bottom, little dog ear at the bottom, and I'll convert it into a short T because that scar's hidden. So yeah, it's a bit like earlier when we were saying about complications and risks, and if you don't want risks, don't have surgery. It's the same with the scarring. I'll show you photos of scarring. You might say, God, I don't want scarring like that. Well, that's fine. Then don't have a lift. But a lift is no one wants a lift. A lot of people say, I don't want a lift. I'm like, no one wants a lift. If they could get the same result without the scarring, they'd have it. They want the result. So the question is, how much do you want the result? And if you don't want the result, if the scarring is worse, I certainly don't want to cure one problem. Haven't I done a great job on making your breasts a better shape? And you're like, well, look at all this scarring all over the place. I'm not happy with that. So I haven't done a good job then. If you're not happy with the scar, if you haven't realized that the scarring is going to be there. So, it's about realizing that you have to have scarring if you're going to have a lift. And let's face it, it's going to be visible. I say that it's hidden in a bra because it's just on the nipple. But if you take your bra off, if you can see your nipple, there's scarring around there. And as I say, for me, the minimum is the lollipop, is the scarring down and along. Oh, look, Kazia's here. Ask JJ. Kazia, well done. I think Olivia tried a couple of Ask JJs, but it's been very half-hearted this evening. We needed a bit of Ask JJ here. Thank you for that. We need to remind them, Kazia, because God knows, look, there's been all these non-Ask JJ hashtags. Anyway, thank you for that. Well, I'm out. So, yes, you cannot have a breast lift without visible scarring in my book. God, if you could, I would be doing it all the time. Oh, here we go. Stacey, it's everyone's personal choice. I'm sick of hearing there's nothing on you. You don't need it, but there's not the ones not being able to wear a bikini. Absolutely, Stacey. I get that a lot. People say, my friends say, you don't need it. You look fantastic. You're beautiful as you are, etc., etc. But it's up to the person, it's up to the individual. We can't say you look okay. All I can, and Stacey, were you asking about the mini and the full? Yes, you were. And it's the same with the mini and the full. I can't say you need a mini or a full because you don't need anything. You're fine as you are. You are fine as you are. You don't need anything. And it's a question of what you want and what you want to achieve as to whether the mini or the full. So I'm limited as what I can say to you if you send a photo. I will, if you really haven't got much there, I might say, look, I think I might struggle to do a full. Although there's no substitute from actually examining you and feeling the skin laxity. You really need to get a feel of that skin laxity to see whether you can do a full tummy tuck. But really, on people who've just got a little bit of fullness above the pubic area, then a mini might be the way to go. But if there is more there, then it's really, a discussion as to what you're trying to achieve, because there's everything from a full tummy tuck to nothing with a mini in between. And, all there's good and bad about all of those options. And it's a question of I can't tell you which option to choose, sort of thing. Is that clear? Got a bit spiritual tonight. Another week done. Hashtag Ask JJ. If anyone's got any questions, please Instagram me, Facebook me, or do whatever you want, email or whatever. I'll be very happy to talk about it next week. And I know I've got to talk about aging skin, weight loss, slow age, stress, skin surgery. Stacey, you've been helpful. Thank you so much. Thank you for your questions, Stacey. Couldn't do it without you. It's you, the people. It's you, the great members of the British public, that keep this Q&A going. You know that. I couldn't do it without my fans and my supporters. Couldn't do it without you guys. Jackie, you've been keeping quiet. Thank you. Jackie, don't tell me, Jackie, you've been in all the time. For goodness sake, have you not got something better to do? Come on. Get yourself on the, surely Antiques Road Trips on or something. Right. Thank you, Kim. So I'm going to check out here. I suggest you do likewise. And I will see you same time, same place. Hashtag Ask JJ, Tuesday night.